Right. My name is Dinamulla. I'm working as associate specialist in anesthesia attached to Kettering General Hospital, NHS Foundation Trust, UK. So in the next few minutes, I'm going to present this audit we completed recently, endotracheal tube cuff pressure monitoring. So as we all know, inflation of endotracheal tube cuff pressure can lead to airway injuries. It can be simple mucosal edema, can go up to mucosal ischemia, tracheal stenosis, and it can present as mild sore throat, lasting longer, and can lead up to loss of voice completely. So AGB recommend endotracheal tube cuff pressure, and not only the ETT, as well as the laryngeal mask airway cuff pressure, to be assessed once it's inflated. So the recommended theoretical values is between 20 to 30 centimeter of water to provide adequate seal and reduce the risk of airway complications. So based on these facts, we did the initial audit in 2020, December. So it's carried over a period of 10 days. Endotracheal tube cuff pressure was randomly measured in patients going to emergency and elective theater surgeries. So all patients received the oxygen and air as a gas mixture. So this is the rough summary of data we gathered from the initial audit. There's a total of 41 patients. Out of 41, 21 had the cuff pressure in the desirable range less than 30. And in between, there are like 14 patients, and higher pressures, more than 59, were recorded on 6 patients. So out of 41 patients, 18 of them, that is 44% of the total number of patients, anesthetist has to inhale and reduce the cuff pressure to a lower value. And so this audit revealed that routine measurement of endotracheal tube cuff pressure after intubation was not practiced as a routine in our trust. So only 51% of the total patients had the cuff pressure within the acceptable range. And it's quite concerning to have the very high cuff pressures like 90 centimeter of water, which is not acceptable under any clinical circumstances. So we made some recommendations on the audit and got done the interventions as well. So mainly is awareness. So just to introduce our trust, so we have operation department practitioners working along with the anesthetist, supporting him throughout the anesthesia care. So we call them ODPs. So awareness mainly targeted the ODPs plus the anesthetist as well. So encourage them to measure endotracheal tube cuff pressure using the manometer all the airway trolleys were equipped with. And going forward, so we were still on paper-based system, and so we are slowly transitioned to a paperless setup, but we are still at the very beginning. So anesthesia charts were maintained on the paper sheets, but there is a theater management system. We enter patient data after WHO checklist. So that will link to patient records, which will be carried to patient as well. So we, as part of the anesthesia data, so we included endotracheal tube cuff pressure into the theater management system. So we called it Blue Spear. So after almost a year, we re-audited again in 2023, June. That audit was carried over a period of 2 weeks in the same way. Endotracheal tube cuff pressure was checked randomly on emergency and elective patients. And all patients again used oxygen and air as the gas mixture. So the summary of data we gathered after the re-audit is as follows. Total was 41 patients. Out of 41, 31 had the cuff pressures less than 30 centimeter water, and higher pressures more than 59 centimeter water also recorded still on 2 patients. And out of 41, 7 patients, anesthetists had to involve and reduce the cuff pressure to a lower value. So the highest pressure recorded was 70 centimeter of water again. And overall, 76% of the intubated patients had the inflation pressure less than 30 centimeter of water, and also anesthetists did not have to adjust the cuff pressure. Again, 17% of the patient, the anesthetist had to reduce the cuff pressure to a lower value. So based on the data we gathered from both audits, when it comes to the re-audit, the percentage of patient needing the cuff pressure to be lowered by the anesthetist has reduced from 44% to 17%. And incident of high cuff pressures more than 30 has reduced from 49% at the initial value and down to 24%. So those two we took as an area of improvement we made, but still it's concerning to have the recording of very high cuff pressures more than 59 with the highest pressure of 70. So we had that range on recordings on 2 patients. So after the discussion, the conclusion we came is in our trust, there's a frequent change of theater staff. So it happens not only the operating department practitioners or DPs, but other theater staff as well. So what we recommend again is this awareness has to be an ongoing process, because the staff getting changed quite frequently, and there are new staff appearing on temporary contracts also. They won't stay longer in the theater. So this awareness has to be carried on continuously. So we make sure that this information is accessible to new staff arriving during their induction, and also especially for the operation department practitioners. And it's also, we encourage anesthetists to recheck cuff pressure whenever it's possible. So just to make sure that it will prevent any accidental hyperinflation of cuff, so they can involve and reduce it, and then the risk of airway injury would be minimized. And so endotracheal cuff pressure is now is a recorded value on our anesthesia theater management system. So, but it does not guarantee that all the cuff pressures were recorded, entered into the theater management system. So we are following it up and make sure that it will all the cuff pressure recordings will be correctly entered into the theater management system as well. So this all would reduce the risk of accidental airway injury that can happen due to hyperinflation of endotracheal tube cuff. So that will come to the end of my presentation, actually. Is there any questions?
High compliance require higher pressures in the cuff?
So I didn't get the last part correctly, very clear.
Oh yes, they require higher pressures in the cuff.
Yeah, so there's this is a theoretical value of 20 to 30 is the desired range, but there are clinical circumstances that anesthetists need to inflate to higher pressures. But our point here mainly is whether anesthetist has to involve and reduce the cuff pressure to a lower value based on clinical needs. So our initial audit, the 44% of the patients, anesthetists reduced it to a lower value. But when it comes to second round, it was down to 17%. So that's we took as an improvement. But theoretically, yes, it's not reaching the target below 30. it reaching the optimum value for that patient based on the surgery.